Hey, good afternoon, Scurry County. Dan Hicks, your Scurry County judge here. I'm going to give you an update, okay, and then we're going to talk about a couple of things. All right, so as of today, there are 4 new COVID positive cases in Scurry County, bringing our current positives to 9. There's 11 total cases, which include the 2 cases from early April. And we've decided that since they're so far in the past, we're going to go ahead and show those as recovered. So when you look on the Scurry COVID page, you're going to see that we're going to have those that as recovered, but we'll still have a total of 11 cases and 9 current cases. Okay. We've had a total of 393 tested in Scurry County, 13 are pending, 369 are negative, and we have 11 positives total in the 2 recovers. So remember that 9 current and 2 recovered, that's 11. So the newest cases are a female 35 to 45, a female 10 to 20, a female 15 to 25, a male 35 to 45. The previous cases that we had was a female 55 to 65, a male 55 to 65, 2 females 35 to 45, and a female 15 to 25. So in the future, after today, I'm not going to give you the list and age and male or female of the previous ones. I'm just going to give you the current ones because, as you can tell, we're jumping pretty quick. That's 9 cases in 3 days. All right, so there's a lot of questions and comments about what information is being put out by Scurry County. One of them I'm going to address are the people from Snyder or Scurry County. When we give you a new positive case or tell you that there's a new positive case, they are Scurry County residents. If someone from another county tested here, that positive goes toward that county, not towards Scurry County. Were these positives from the testing done by the National Guard a few weeks ago? No, they were not. There were 13 tested on that date. They all came back negative. If someone came in from another county to get tested on that date, if they had been positive, it would have been shown in their county, not in our count. So our newest positives had nothing to do with the testing that was done on that date. Here's the biggest question that I'm seeing a lot of, and this has caused a lot of issues. Why don't we list everywhere the positive cases have been? So the Scurry County Health Department has limited staff. The first priority of the health department is to do the contact tracing. And I'm going to get into the contact tracing here in just a few minutes and kind of explain some of that. They're going to do the contact tracing and contact those direct contacts who may have been exposed, and then go down the line. As you can tell, with 5 new cases in 2 days, now totaling 9, the contact tracing itself, it's extremely time consuming. As we reported yesterday, an employee at a law enforcement center tested positive, and about 140 tests will be done in the next few days. That's not saying that all 140 of those people had contact, but this is an abundance of caution for the law enforcement and that community, the health workers, EMS, police, fire, those, and any of those contacts, and the jail. The number of those to be tested is going to rise as the contact tracing continues. The limited staff at the health department is extremely busy with the contact tracing investigation and will continue to be until they reach the very last person directly contacted. So think about that. How many people do you contact in one day? Multiply that by 9. And that's just where we are right now. Okay. So contact tracing, it's a very involved process. It begins with finding out every individual the person who tested positive has come in contact with, beginning with family and friends, and moving on to any businesses they might have gone to. Contacting all of those individuals and starting an investigation on those individuals and preparing to get them tested and possibly quarantined. That's the next step. With 9 cases, you can imagine how involved this process is and how long it'll take for each person. The paperwork is 5 pages long for each person. The initial contacts is usually between 10 and 25 people. So 9 times 25, 9 times 10, 90. It's a lot of people that they're going to have to contact. Then the contacts of those contacts are contacted. So each person, 10 to 25, let's just say it's 10. One person contacted 10 people. 90 people, they're already at 90 people, then you're at 90 times 10, gets to be a lot of people. This process is very labor intensive and very detailed. So this is part of why they're not going and talking to all the business or telling you who all the businesses that all of these people have been to. It'd be impossible to tell you every business that every person has been to. And then if they do that, then we've got other issues as well. What we're finding out is that those who've tested positive have been going throughout the county into different businesses. We're not going to name those businesses that they've been to, but those those businesses who have been contacted or will be contacted if the need arises. So if we feel like we have someone who is a direct contact or someone who is a positive has gone to a business, we're going to let that business know. If you own a business and you don't hear from the health department, you should be okay. Having said that, continue to sanitize, continue to social distance in your business. Request people wear masks if you would rather they wear masks. But wipe down your doorknobs, everything that people touch, cash registers, the pin pads, all of that. Wipe it all down if you own a business to protect yourself and those that come in. As we said from the very beginning of this pandemic, treat everyone as if they had COVID-19. You remember, you go back and look at some of the videos, that's what we have said, is treat everyone as if they had COVID-19. And if you do that, you should be protecting yourself better. Don't shake hands, don't hug, social distance, wash your hands, don't touch your face, wear a mask when you go somewhere. If you choose not to, respect those that do wear a mask. There are some of us that have more at-risk people that are in their lives. Personally, I'm a diabetic, okay? I could be considered high risk. I'm not worried so much about me. I'm worried about the other family members that I have that have a higher risk than I do. So if you see somebody and you you try to get up to them, you see them take a step back, don't treat them disrespectfully. They're trying to protect themselves and protect their families. So what we know is that wearing a mask is 80% protecting you from them and 20% protecting themselves from you. So it's better to wear the mask to protect somebody else. Like I said, many of us have someone close to us who are more at risk, either because they are elderly or have an underlying condition such as diabetes, cancer, asthma, or a compromised immune system. I've had a lot of people tell me they aren't afraid of getting COVID. Now that's good, but think of those who do have a healthy respect for the disease. And I'm not saying that we're going to go backwards, that we're going to do anything different than going forward with what we have, where we are. I'm just saying we need to be cautious. We need to be mindful of protecting others, not so much ourselves if you're not worried about yourself, but be respectful and mindful of others. As in all things, we have varying opinions from one extreme, open everything up, to the other, shut it all down. I'm in the middle. I want to open our community back up, but I want to do it responsibly. I have a healthy respect for COVID, not because I'm concerned for me, but because I do have those that are close to me that are more at risk. It's proven that those who have underlying conditions have the hardest time with COVID. Keep in mind also, and I really want to stress this point, those that have COVID are not just a number. It's not just 9 people, 9 cases. It's not 9 cases. It's 9 people that have COVID. These are real people with real lives, real families, real fears, real thoughts about what's going to happen now. This disease affects everybody differently. So we are now in the middle of it. We have 9 cases current. Please be respectful of that. Be respectful of those that have it, that might want to, or don't have it, that want to protect themselves from it. I can also tell you that we're in contact with Texas Department of Emergency Management, and they are aware of what's going on. We've also been in contact with Jody Arrington's office, and they are aware of what's going on. The main point I want to make is let's be respectful to each other. Let's appreciate one another. Um, it's getting kind of nasty out there, some of the comments. And you got to remember that those that have been working with this, the medical profession, the police, the fire, the EMS, the health department, they hadn't just started working with this since we started getting the 9 cases. They've been dealing with this from day one. And it's not just 8 hours a day, it's all day, every day for the last 3 months. So they are doing everything they can to take care of this situation, and take care of you and protect you and I and our families as best we can. So with that, I may have an update tomorrow. I don't know. If we have more cases tomorrow, I'll let you know. If we have more cases on the following day, I'll let you know. Right now, I don't plan on it, but if you see that I'm going to have a briefing, it's because we have more cases. So with that, I hope you have a good Memorial Day weekend. Remember those that fought for us, and to protect our freedoms that we have every day right here in Scurry County and the United States.